A 2-year-old Hispanic male presents to the emergency department with complaints of right arm pain and injury. The mother states that he opened the unlocked sliding glass door and fell forward onto his abdominal area onto a brick patio. She did not witness the event but believes there is no loss of consciousness as he immediately began to cry. She went to his side and found no bumps or bruises, but he did brace his right arm, and so she immediately brought him to the emergency department. She denies cough, fever, rhinorrhea, nausea, vomiting, or diarrhea. And she denies any rash. States that he has been eating and drinking normally with no changes in the recent history. She did give him Tylenol for pain at home and then immediately brought him to the emergency department. She states that all of his immunizations are up to date, that he has no known allergies, and that his past medical history is negative for any asthma, cardiac disorders, bleeding disorders, or any congenital anomalies. There is no family history of any of these as well. There has been no recent travel. On physical exam, he appears frightened and in distress. His head is normal cephalic and atraumatic. Sclera and conjunctiva are clear with no erythema noted. He does have significant tears from crying. The ears are easily visualized. All landmarks are easily visualized, and the tympanic membrane is intact and pearly gray with a positive light reflex. The nares are patent, and the throat is moist with no edema or erythema present. Cardiovascular-wise, S1 and S2 heart sounds are present with no murmurs detected. The patient is warm and well perfused with +2 pulses throughout. Lungs are clear and equal bilaterally with no adventitious breath sounds heard. The GU exam is deferred. Musculoskeletal exam, the right arm has decreased strength and decreased movement. Left arm and right and left lower extremities have +5 strength throughout. His right arm is able to be moved in the lateral direction, and he is able to supinate and pronate his arm with assistance, although this does cause him significant distress. He has decreased use and movement of the right arm compared to the left. However, the skin color and CMS exam are intact. On the skin exam, there is otherwise no rash, lesions, petechiae, purpura, or ecchymosis visualized. The right arm is slightly edematous. GCS score is 15. The patient is alert, appropriately interactive, and scared of the medical staff. For my differential diagnosis, I would believe that he has a right arm fracture. He could also have an osteomyelitis, a right arm cellulitis, or a wrist sprain. My impression is that my plan is to obtain a radiograph of the right arm, a PA and lateral film of the arm, as well as a lateral view of the distal, radial, and humeral head, and an x-ray of the elbow as well. I will also give him ibuprofen, as he has only received Tylenol at home to control the pain and swelling of the arm, and plan to elevate and ice the arm. My impression is that his x-ray did come back with an oblique green stick fracture at the right radius mid-shaft with mild apex dorsal angulation and mild bowing of the mid-shaft ulna per the radiologist. There is no dislocation visualized. My impression is that he has a right oblique green stick fracture, and he will be placed in a soft cast until swelling has decreased, and he will be consulted and referred to orthopedics to have a hard cast placed for 3 to 6 weeks. He should continue with the ibuprofen and icing to decrease the swelling. And parents should continue to monitor his hand for color and movement.